So, good morning, good afternoon, good evening. My name is Trevor Hassel, and it is my pleasure today to moderate and chair this first in a series of webinars hosted and sponsored by the Healthy Caribbean Coalition, supported by Sagicor Life and the University of the West Indies Open Campus. The webinar is aimed at building advocacy capacity for childhood obesity prevention in the Caribbean. A special welcome to everyone. Over the next several months, HCC and its partners will host a series of webinars on childhood obesity prevention in the Caribbean. These webinars will highlight policies that encourage the creation of healthier food environments, including healthy school policies, front of package warning labels, and sugar sweetened beverage taxes as effective approaches to childhood obesity prevention. In today's webinar, titled Childhood Obesity, Time for a New Narrative, several regional champions and experts will make presentations during which the burden and drivers of childhood obesity in the Caribbean will be explored. An insight into global and regional childhood obesity prevention responses will be provided. The importance of sensitizing the public before the introduction of policies will be emphasized, and the key role of the youth in the childhood obesity prevention agenda highlighted, after which there will be a moderated discussion, the panel of presenters. There are really 4 dimensions to a new childhood obesity narrative. Recognition that obesity requires multiple discrete actors and sectors to work together simultaneously through many entry points. A change of the words and images used to portray obesity so as to shift blame from individuals and towards upstream drivers. Thirdly, rights-based policy approaches that address inequalities and social, commercial, and physical determinants. Fourthly, an appreciation that obesity is a chronic disease within the health system. Today, therefore, there is much to discuss. Many of the themes and approaches that I've just highlighted will be shared as we seek to address the epidemic of childhood obesity in the region. So we will now have a presentation by Dr. Audrey Morris, who's the Decentralized Regional Advisor for Food and Nutrition, NCDs, and Mental Health at PAHO WHO. Go ahead, Dr. Morris.
Okay, you're hearing me now. Now, obesity has been recognized, as an alarming public health problem by the highest level of leadership. In April 2016, the UN General Assembly adopted the resolution, the Decade of Action on Nutrition 2016 to 2025. And the leaders committed at that time to reversing the rising trends in overweight and obesity and reducing the burden of diet-related NCDs in all age groups. So they therefore expanded previous mandates from tackling not only undernutrition, but all forms of malnutrition, which therefore includes not only undernutrition and micronutrient deficiencies, but now overweight and obesity, and the diet-related NCDs such as cancer, diabetes, and cardiovascular diseases. The UN Decade of Action calls for all member states to act on the commitments and recommendations agreed at the Second International Conference on Nutrition, ICN2, and there are 10 commitments and 60 policy action recommendations in the framework for action, and I would recommend that you take some time to look for those and acquaint yourselves with them. Now, there are several global and regional mandates and recommendations related to childhood obesity, and you will see several of them there. The Global Strategy on Diet, Physical Activity and Health, WHO guidelines on sugars and on sodium intake for adults and children, the set of recommendation of the marketing of foods and non-alcoholic beverages to children. At the front there you have also the PAHO Plan of Action for the prevention of obesity in children and adolescents, the PAHO nutrient profile, and several others. I'll focus a bit on the PAHO plan of action for the prevention of obesity in children and adolescents, and that was unanimously approved by member states during the 53rd Directing Council of PAHO in 2014. That plan of action has 5 strategic lines, and I'll go through them for you. The first line of action is primary health care and promotion of breastfeeding and healthy eating. The focus there is on breastfeeding. As you can see, WHO and UNICEF have developed 2 documents: the guideline for promoting, protecting, and supporting breastfeeding in facilities providing maternity and newborn services, and also implement guidance on the BFHI. And that is because of the recognition that we have to start tackling the problems from birth. And so setting the stage from birth with the BFHI, the Baby Friendly Hospital Initiative. The guideline has key recommendations, summary of the supporting evidence, and a description of the considerations for consensus decision making. So that's strategic line of action 1. The next one is the improvement of school nutrition and the physical activity environments. And we've been doing quite a bit on that because scientific evidence has demonstrated the effectiveness of school-based interventions in changing eating behavior and in preventing overweight and obesity by providing meals that meet the dietary needs of children and adolescents. So on the one hand, we need to regulate the expansion of the ultra-processed products that has been taking place in our region, as that has been one of the main drivers of the obesity epidemic. But on the other hand, we have to strengthen the good side of the food system that favors the production, preparation, and consumption of healthy meals. So this line of action focuses on that. As I said, there's a focus on schools, and we have recognized that Brazil has been a pioneer in implementing policies and programs that really we should try in the Caribbean to emulate somewhat. I'll just note that there is a need in that country by their requirements that the food provided for students should be natural or minimally processed, and a minimum of 30% of the school budget is used to buy foods from local family farmers. So PAHO has been supporting countries in taking similar approaches. The strategic line of action 3 is fiscal policies and regulation of food marketing and labeling. And for that, yes, the fiscal policy on sugar-sweetened beverages in Mexico, I'll draw your attention to that. That country had a specific regulatory measure, a tax on production and services levied on sugar-sweetened beverages. And we know that other countries in the Caribbean have now been introducing similar a similar strategy, and PAHO is supporting the implementation of such policies throughout the region. So another activity also was the approval of the Food Act in Chile, and of course the work that you know we are doing in food labeling, especially front of package labeling. We are also recommending other multisectoral actions because obesity, childhood obesity, is not a health problem alone. It has multisectoral actions from other government sectors and non-governmental sectors as well as the private sector where appropriate. So 2 areas addressed by the plan of action are the provision of urban spaces for physical activity and measures to increase the availability of and accessibility to nutritious foods. And the final line of action is surveillance, research, and evaluation. So we are at the point now, having had that plan of action since 2014, we are tracking and helping member states track their progress in implementing policies to prevent obesity. So you will see the link at the right of your screen there, and that takes you to an interactive tool that will enable you to explore regional and country progress by country, by policy area, etc. So in a nutshell, I'll say that that summarizes one of our main tools in the fight against childhood obesity, the PAHO plan of action. And I will make the slides available for you. Thank you very much for listening.
So thanks very much, Dr. Morris, for that excellent review of the international and regional perspective as given by PAHO WHO. What we'd now like to do is invite Professor Samuels Alafia, if you would now proceed with your presentation, what's driving childhood obesity in the Caribbean. Alafia.
Thank you very much. I just unmuted, so you should be hearing me okay, I hope. So childhood obesity in the Caribbean, the burden is extensive. From this graph of the Global School Health Survey among the countries that did so, these are 13 to 15-year-olds across the region. Extremely high rates in Bahamas, and this is obesity. So more than 20% in the Bahamas, usually related somewhat to the per capita income of the country. So those countries that have more disposable income tend to have greater obesity rates. And it's not only high, but it is increasing. These are the rates of childhood obesity in small island developing states. The green, the top line is the Pacific, and followed closely behind by the Caribbean. So this is really a problem that is not only bad, but getting worse. So what are really the drivers of childhood obesity? Well, at the heart of it lies a change in our culture. We have gone from being active farmers and gatherers, hunters and gatherers, to now being persons, a lot of us sit at desks all day. We have also gone from eating what we grow to eating at fast food restaurants, eating a lot of ultra processed foods. And of course, the problem of physical activity, which contributes to obesity, but not as much as diet. So we should be very clear that it is the diet that we really need to focus on in that regard. So here are some rates for the Caribbean in terms of how many children are having adequate amounts of physical activity. And in no country does it get to 40%. So in every country, the majority of children are not having enough physical activity. So physical activity is important, but exercise alone won't work if you are eating whatever. The lot of the big soda and the big food companies are trying to align themselves with physical activity and trying to make the point that, oh, you can, eat whatever you want, just remain physically active. That is not so, and it is a line that's being promoted by big food and big soda, and we have to be very conscious of that whenever we hear that that position being put. We have, as I mentioned, transitioned to processed food. There are about 6 or 8 companies that control most of what most of us eat. And these companies, obviously, their bottom line is the most important thing to them, and profit. And therefore, they sell what makes profit. right now they have created a food culture that encourages people to eat ultra-processed foods high in fat, sugars, and salt, and they're able to provide these at fairly low prices, which is part of what is driving the obesity. But in addition to that, we have the concept of commercial determinants of health, where these multinational food and beverage companies promote the overconsumption of unhealthy food. And marketing has shifted from high-income countries to developing countries, including the Caribbean, especially developing countries that have high levels of disposable income and high income status, middle income status. As we saw from the first graph, it's the countries that have the most disposable income that have the most obesity. We have to pause for sugar, which is such a special contributor to this whole problem. Sugar in drinks is indicated there in red, this graph. So this graph is showing the contribution of a number of different types of food to the average diet across the age group. So as you go from left to right, you go from birth basically to age 80, and you see the different colors indicating at each age what proportion of food. And this is the graph for the global perspective. And now let's look at Barbados. Barbados is fairly typical of the Caribbean. We saw in the other graph earlier that there are numbers of countries that are similar, and the consumption of sugar among children is really very high. And this is the results from the Global School Health Survey also about carbonated drinks recently. We know there's a lot of sugar in a number of these products, and even fruit drinks often have as much sugar as soda. The problem with sugar in drinks is that it's wasted calories because they don't satisfy hunger. It's empty calories because these drinks mostly contain no nutrients. And it's dangerous calories because these sugars are absorbed very quickly and cause a spike in insulin and then a sugar crash, and are associated with diabetes later on in life. And sugar is everywhere. The labels come in all types, processed foods of all sorts having sugar. And everywhere you look, there's sugar, and it's enticing you to have more of me. And advertising, as I mentioned, the marketing is very critical. It targets young consumers. They do the different avenues that are being used to target these children. Television and film program sponsorship, product placement, internet gaming, which they have the ads right in there, event sponsorship. Every time of the World Cup you score a goal, you cheer for the goal, and there's Coca-Cola right in the background. Promotional characters, you know, Tony the Tiger on cornflakes. Really, what's the connection between a tiger and cornflakes? But people love Tony the Tiger, so they put on the cornflakes box. They give away. We know all about going to the McDonald's, seeing the toys, and the children want to go back and want to get more of that. And in the Caribbean, we have an example I'm showing you here. It's not only the international multinational companies, it is also in the Caribbean where we have local fast food companies marketing directly in the schoolroom, where they provide book covers that are branded, and the children look at the fried chicken all day and want it when they go home. The pencil cases, everything branded, and we're brainwashing these primary school children. The effects of this the food advertising is that there's increased meal frequency, there's increased fast food consumption, increase in snacking, increased intake of dietary fat, and lower intake of fruits and vegetables. And children learn these brand preferences from very early. By 6 months, they're forming mental images, and by 2 years, they have the beliefs about where they want to go, are making specific requests already. And this investment will bring back to the fast food company about $100,000 US once they get the child hooked at that early age to love them so much. As a result, right now, 30% of our children's calories are coming from sweets, drinks, sweet drinks, salt snacks, and fast food. So we have a challenge, and we need to address it. Dr. Morris talked about the different lines of action, but it's a big problem, and it's a problem of culture. where the culture has been changed through marketing. And I think we need to approach it at that level as well. Thank you.
So thanks very much, Professor Samuels, for that excellent overview of what's really leading to the childhood obesity epidemic in the Caribbean. We're going to move right on to a presentation now by Maisha. Maisha, of course, is the Executive Director of the Healthy Caribbean Coalition. And Maisha will share with us the regional civil society response to childhood obesity from the HCC's perspective. Maisha.
Good morning, everyone. It's a pleasure to be here and so happy to see so many of you coming out for the webinar. So I'm going to get moving and start with a bit about the HCC. For some of you who've not been familiar with us, we're the only regional NCD alliance of over 120 NCD organizations in the Caribbean, health and non-health NGOs. And this is just a snapshot of the kind of the work we do, the broad array of publications that we have. So obesity in the Caribbean region, I'm not going to get into the details because Professor Samuels just covered the burden. But I'd like to share a bit about the action plan that the HCC developed in 2017, really to help us to guide the regional response from civil society to support national responses aimed at tackling this issue of childhood obesity in the Caribbean. Our implementation partners, because we recognize we cannot do this work alone and we're committed to a whole of society and whole of government approach, are first and foremost our members, so CARICOM civil society organizations, CARICOM governments, the Pan American Health Organization, the Caribbean Development Bank, the Open Campus of the University of the West Indies, CARFA, CARICOM, and our global partners, the NCD Alliance, Global Health Advocacy Incubator, the World Cancer Research Fund and World Obesity Federation, and of course our funders, Sagicor Life. So we have a number of key or priority policy asks, and they really revolve around taxation of unhealthy foods and beverages, mandatory front of pack warning labels for foods, prepackaged foods, enacting legislation banning the marketing of breast milk substitutes, and banning the marketing and sale of foods and beverages to children, and then schools policies, like banning the marketing and sale of unhealthy foods and beverages in schools, and policies around mandatory physical activity. The snapshot in the region at the moment is, in terms of fiscal policies, those being taxation on sugary sweetened beverages, we have taxes in 3 of our 20 CARICOM countries, Barbados, Bermuda, and Dominica. We have school policies which ban or restrict SSBs in schools in 4 countries. We have marketing regulation in 0 of the countries and mandatory front of pack nutrition labeling also in 0, so we're currently working on in the region. So HCC's response is built around 4 key elements: awareness, capacity building, and advocacy, building coalitions, ensuring accountability, and high-level regional advocacy. And I'm just going to run through some examples of each of those. We have a childhood obesity prevention portal on our website, which really aims to provide the tools for our members to first of all ensure that they're aware of all of the issues. So we have fact sheets, and then they have the advocacy tools they need to advocate effectively to their national governments. Here's a snapshot of our fact sheets. We have one for each of the country. We worked in partnership with the University of the West Indies to develop these fact sheets, and we also worked in partnership with our local CSOs. We have a sugar infographic series, which basically looks at sugary beverages within countries and regional and iconic sugary beverages, and we provide the content of the sugar and mark those against the daily maximums for children and adults. Again, tools to help with advocacy. This is a snapshot of a product we have where we're looking at serving sizes for recommended fruits and vegetable maximums per day, and this is again using regional fruits and vegetables. We're also doing a mapping, an ongoing mapping of industry. Who are the food and beverage industry actors in the region, those producing ultra-processed foods? Who are they are actors targeting children? And what is the level and what does it look like of industry interference in the policy-making process? We're also committed to building CSO capacity. This is central to the work that we do. So we have a number of grants in which we onward grant to civil society organizations. We hold a number of meetings. We support outreach, and we host webinars such as this one. Last year, we had a regional call for action in which we called on heads of government to really commit to following through on their pronounced commitment to addressing childhood obesity in the Caribbean, and we got over 21,000 signatures of support for that. And we're committed to creating youth advocates, and you'll hear from one of those in this presentation today. So coalition building, again, how can we support to build national obesity prevention coalitions? We've done that in Belize, and you'll hear more about that. We've done it in Bahamas, in the Barbados, and also we work with NCD commissions to build their capacity to effectively advocate for these types of policies. Accountability is also a critical area for us. One of the initiatives that we recently launched in partnership with PAHO and one of our partners, Health Advocacy Incubator, is the My Healthy Caribbean Schools, which really empowers the community to go and rate their school to see how does their school stack up in terms of providing in healthier environments in which children have access to healthy foods, in which they have access to physical activity. We also have our childhood obesity prevention scorecard, and this is quite unique for us in the sense that 2 years ago we were at a meeting in the World Health Assembly, and the ministers of health asked if there could be some sort of regional platform in which we were monitoring the policy landscape around childhood obesity prevention, and this was something that we had already to as part of our action plan. And what this does is it provides a snapshot of the policies which have been implemented, and where there are policies that are implemented, we provide a link to the actual legislation or the policy document to support advocates and also to support governments to be able to implement the similar types of policies. We're also looking at managing of conflict of interest in the Caribbean. This is a critical area for us and something which is very important in particular in this area of working with the food and beverage industry. High-level advocacy, we are committed to, again, working directly with those individuals who make the decisions around the policy environment. And so we've worked on building champions. This is former First Lady of Trinidad and Tobago speaking at a high-level side event at the 72nd UNGA. We have open letters to heads of government. We did this in lead up to the high-level meeting last year, the third high-level meeting on NCDs, and we had a very positive response. And we were at the high-level meeting, again, pushing this obesity agenda, and you'll see in the picture on the left, you've got the prime ministers of 2 CARICOM islands. You have one of our CSO representatives from HFJ in Jamaica, and then we were part of the launch of the Caribbean Moves initiative as well. So our current focus as we move forward, again, working in partnership with a diverse group of partners at the center of which are our civil society organizations, continued advocacy for healthy school policies, continued advocacy for taxation of sugary beverages, and currently we are working very hard around front of package nutrition warning labels to support this process and ensure that we are moving towards a regional standard. And we're also hosting a regional meeting upcoming in June on this very issue. And I thank you.
So thanks very much. Thanks very much, Maisha. It's quite evident that civil society in the Caribbean, both at the national and the regional level, is significantly engaged in this effort at childhood obesity prevention. We'll move now for a presentation by Barbara McGaw. Barbara is the program manager in Jamaica of the Global Health Advocacy Incubator. Barbara also has many hats, other hats which I'll not necessarily share with you at the moment, but suffice it to say, Barbara will share with us Jamaica's response with the very exciting title of the Are You Drinking Yourself Sick campaign. Barbara.
Good morning, all. Thank you for having us on this webinar. So we're going to talk a little bit about Jamaica's response to the Are You Drinking Yourself campaign. First of all, I just want to talk about why we've done this, and it's been very clear in earlier presentations that the obesity challenge both in adults and children is a matter of real concern. And these are the data from Jamaica. 1 in 3 Jamaican adults has hypertension, 1 in 2 is overweight, and the rate of overweight obesity in youth is actually around 38%. So the Global Health Advocacy Project through the Heart Foundation of Jamaica has several objectives. increasing public support for obesity prevention policies, through education, and of course, building support for policymakers and key stakeholders for tax and support for front of package labeling. Trying to improve the food environment by advocating for policies to restrict the marketing of healthy food, and to develop timely mass media campaigns, which is what I'm really going to be talking about today. So, as Maisha said, our partners are always important. We cannot do this alone. We have collaborated closely with the Ministry of Health and Jamaica Moves, of course, NGOs, faith-based other civil society members, Caribbean Institute of Health Research, and of course the National Food Industry Task Force, which also works on aspects relating to obesity. So the mass media campaign was in 4 phases. Starting, we're setting the stage, communicating how harmful sugary drinks can be, looking at the amount of sugar in a teaspoon and so on. Phase 2 looked at amplifying the message now, increasing the awareness and encouraging parents and guardians to be responsible in terms of children's health, and calling for support of government restriction in sugary drinks in schools. Phase 3 and 4 really focused on the message now, increasing awareness of the harms, but calling for the tax and supporting government restrictions of sugary drinks in schools. So here are just copies of the 4 phases. As we said, we are now in phase 4. As you can see in the logos, if you're able, that the Heart Foundation logo, it was in collaboration with the Ministry of Health and Jamaica Moves. But please note, on the 4th phase, where we're really asking for the tax, although the Minister of Health and the Ministry was in collaboration, because it's at a government level, there was not full support, they would have had to give up their support. So the integrated marketing communication campaigns were by television, radio, print, social media, billboards, and so on. Our advocacy activities really related to sensitization, meeting with ministries, departments, schools, children's rights, consumer groups. We have a lot of communication material and, of course, sustained media and social media coverage. What of the real key message was, what we found was very, very successful, was children's right to health, self-efficacy, having to read your labels, healthy alternatives, and policy for sustainable gains. Also, the regional collaboration was important with the HCC call to action, the petition, our HCC Childhood Obesity Prevention Project that we had along with the HCC, the children's letter to the Prime Minister, sharing of social media, videos and so on. So the challenges, of course, the food industry, anybody with a vested interest, in not reducing the level of sugary foods or sugary drinks. There are many umbrella groups and individuals. For example, the Jamaica Manufacturers and Importers Association was very, very opposed to the tax, and they made it very, very clear. There was a lot of conflict of interest. Dr. Samuels, Prof, mentioned earlier, where the companies give away things and so on. So the marketing is very strong. And of course, for those of you who probably know, we were also sued by Fiscal for an image that was inadvertently placed. However, the feeling was that the campaign was to be halted, but we were able to get over that. Finding aligned champions and vendors, that's very, very important, to find people who are aligned and who are supportive. Lack of knowledge, of awareness, of how to read labels, and of course, lack of a formal legislation, both for nutrition labeling, marketing of healthy foods, or even a tax. But we've had some successes. The support for the campaign has been really, really good. Obesity is gaining traction as a, public health issue. Through our work, we have supported the restriction of SSBs in schools and also the National School Nutrition Policy. Very interested, a couple of companies have reformed that we have supporting the project and supporting the call for a tax. These are medical and allied medical organizations. So the pre and post, we did a campaign media evaluation of the campaign, which was national represented with over 1,000 persons. The first one in November 2017 and the second one in June 2018. The key findings showed that 7 out of 10 of Jamaicans attributed a negative health impact to sugary drinks. 8 out of 10 respondents are concerned about the effect of sugary drinks. And very importantly, the parents felt that the school was where the children would have gotten most of their sugary drinks, and they had a real concern. Also, the 71% supported the imposition of a tax on sugary drinks, and this is compared to 64% in the earlier campaign. Now, this figure moves to 81% if the funds were supported for childhood obesity prevention programs. 83% of respondents strongly support policies on the provision of healthy foods in children to schools. So here are just some of the materials that we have produced. So the lessons learned were concern for children impacted the support of the campaign a lot. Public education is a key step. The reputation of the HFG over the years was really positive. Also, the co-branding with the Ministry of Health and Jamaica also very important, and partnership with the NGOs. In terms of the tax, nutrition, marketing of healthy foods, maintain our partnerships, and continue education.
So thanks very much, Barbara. We'll now hear, as it were, Barbados' counterpart to Barbara, in that we'll be hearing from Jan Phillips, who's the Advocacy Officer with the Heart and Stroke Foundation of Barbados. And Jan will share with us Barbados' response. And this campaign is titled the Stop You Too Sweet campaign. We now hand you over to Jan Phillips, Advocacy Officer with the Heart and Stroke Foundation of Barbados. Jan?
All right.
Yes, we can hear you. Go right ahead, Jan.
Okay, thank you. Good morning, everyone. And thank you for the opportunity and the invitation to join your discussion. The importance of such a series, of course, where we share is crucial to our goal, as it is the health of our nation's children. It's the future of the nation. So with that, let me jump right in. I have some cold, hard facts. I know you know this, but NCDs are killing us early. NCDs are now responsible for 8 out of 10 deaths in Barbados. 31% of children in Barbados are considered obese or overweight, and that's staggering. By 2010, Barbados recorded 3 strokes every 2 days. By 2015, cancer was the second leading cause of death in Barbados. NCDs account for 60% of the country's health budget expenditure. Economic cost of NCDs in Barbados is over $209 million annually. Childhood Obesity Prevention Campaign. The Global Health Advocacy Incubator is an arm of Bloomberg Philanthropies, which supports civil society organizations who advocate for public health policies that reduce death and disease. Their expertise, of course, is no secret. We know their commitment in dollars has reached nearly $1 billion since 2007 to combat tobacco use worldwide. So we couldn't be more excited and delighted that they have taken up this fight and finding our campaign to stop childhood obesity. The Childhood Obesity Prevention Campaign was launched in September of 2008, whose main focus at that point in time was education. Of course, some people know about NCDs because it affects them personally or a family member, but this is really a horror story that everyone needs to hear. When we look at the prevalence of NCDs, then look at the lifestyles of people, it does not add up. In other words, we know in part contributors to NCDs, but we still do the things that cause them. So that's where we started with education, to bring a face to NCDs so that people can actually see how it is destroying us. Phase 2, which started in January of this year, is all about advocacy. In a nutshell, it'll be a sturdy advocacy campaign to support policy change, to restrict the sale and promotion of unhealthy food and beverages in and around schools, going forward to lay groundwork for the increase of sugar-sweetened beverages taxes. Everything we do will center around this. So phase one, some of the achievements of phase one. A successful launch of the Childhood Obesity Advocacy campaign entitled Childhood Obesity Prevention, a national call to action with Barbados' Governor General, Dame Sandra Mason as our patron. We also had our president, Dr. Kenneth Connell, who pledged on behalf of the HSFB board their commitment to the campaign, seeing the project as creating health legacy and their excitement to be a part of the revolution. And Dr. Connell sure brings real enthusiasm. Phase one also saw encouraging engagement from coalition members and key holders from civil society organizations. In September of 2008, the HSFB hosted a conference under the theme Collaborative Opportunities and Countermeasures, and it brought together stakeholders and members of the public to discuss opportunities for collaboration along with measures to counteract the pervasive threat posed by childhood obesity. Also in phase one, we had outreach programs with a number of primaries and secondary schools and a launch of the model school programs, with 2 schools actually signing up, but I will come back to that in a bit. So phase 2 activities, we started in January and we've hit the ground running. Already we've made very exciting inroads. This is really a national project, and as such, all hands need to clap at the same time. This project has many moving parts and we are reaching out to all of them. Between February to date, we have already made contact in a very productive way with several coalition members and stakeholders, including ministries of finance, health and education, and Barbados National Council of PTAs, the Barbados Association of Retailers, Vendors and Interpreters, to name a few. In the next few weeks, we shall also be meeting with ministries of agriculture and commerce and a few other entities. Our mass media campaign launch is scheduled for May, and this is when we switch into high gear because our messages will be clear. The aim of the campaign is to address the challenge of obesity prevention through multimedia campaigns for increased awareness of the harms of consumption of sugar beverages and generate support for policies to ban sugary drinks in schools and introduce sugary drink tax. This will take in all forms of advertising, from traditional radio, television, and print to the most popular social media platforms. Model School Projects, My Pet Project, which kicks off in September, starts the new school year with a ban of sugary drinks, and we'll be choosing 6 schools for the program. 3 schools have already signed on, Queen's College, Ranald Weeks, and they're from phase 1, and Foundation has also signed on for this phase. Evidence-based research is crucial, and in November 2018, HSFB commissioned a public opinion poll which was done by cadres, and the results were telling. In short, it received great support for policies to create a healthy school environment. In fact, 88% supported a healthy school meal nutrition standard, 72% supported a restriction on unhealthy food and beverage sales, and 93% supports the availability of clean drinking water, which makes the Water Cooler initiative so timely. And we had a 42% support on restriction of unhealthy food and beverage company sponsorship, but this is understandable as the sponsorship support is very limited. Care School Audit 2018-19, which speaks to marketing and advertising in schools, as well as a school environment survey assessment, which is a qualitative report being conducted by GACDRC, interviewing principals, and is designed to target childhood obesity in the school environment. Whilst preliminary findings are in, we wait the final report. Right, so we are now to the Barbados CSO Coalition. On Thursday, March 11th, we had a very successful meeting of the Barbados Coalition of Childhood Obesity Prevention. It was very well represented by various groups: Barbados Diabetes Foundation, Diabetes Association, Barbados Christian Council, Healthy Caribbean Coalition, to name a few. The discussion featured a number of areas, including joint statements and co-branding, model schools, schools outreach, and public education. Moving very quickly along. For any strong advocacy program to meet its goal, it needs a full support team prepared to ask difficult questions, speak out and carry the message, and I believe the 11 champions we've carefully selected will do just that. Their areas of expertise spans from the legal to entertainment, and within their circles of influence, we have no doubt that their message will resonate. To ensure our message is clear and understood, we conducted a training session for champions which covered their role as champions, and they were taken through the paces of social media. During this training, the feedback session produced a very exciting initiative in helping to get our message out, which we share over the next few weeks. I thank you.
Good. So thanks very much. Thanks very much, Jan. We now move on to another country presentation, if you will, by Heather Renault of the Belize Cancer Society. Heather is going to share with us Belize's experience, in which she'll share the Healthy Schools Belize NCD Childhood Obesity Prevention Alliance, which is a very unique initiative, and one that the Belize Cancer Society and all those in the alliance should be very proud of. Heather, please go right ahead.
Good morning, everyone. Thank you. And I'd like to share with you Belize's response to childhood obesity. Offices of the Healthy Caribbean Coalition. But when we heard about childhood obesity, we had already had some initiatives that they were undertaking with the issue. So some of these actors would have been the Ministry of Health, the National Plan of Action for Prevention and Control of NCDs. The Ministry of Health also has an exceptional early childhood and breastfeeding program out of the Maternal and Child Health Department. The PAHO also had their plan of action for the prevention of obesity in children and adolescents. Package labeling in support of the Belize Bureau of Standards, who was reviewing the draft curriculum regional standards for front of package labeling. The Ministry of Education was also undertaking the initiative to revamp the healthy school nutrition and healthy feeding programs within the schools countrywide. They were supported by the National Council of Families and Children, who developed the National Results Framework for Children and Adolescents in 2017-2030. And then comes the and social partners, who chiefly support advocacy, community education, and sensitization of health issues in the country of Belize. So let me give you a little civil society approach. Being the Cancer Society, we were grateful to be the recipient of a grant in 2018 for advocacy strategies to agitate a national policy or ban of SSBs in and around school. This was done through the Healthy Caribbean Coalition. Along with this grant came the ability to host an in-country capacity building workshop. Now we quickly realized that for the fulfillment of this grant, it should not and could not be only a Cancer Society initiative. It had to be a collective initiative. So we invited social partners to participate in this workshop. As you see here, we had representatives from the Ministry of Health, the Attorney General's Ministry, civil society, other organizations that support private sector as well, just for them to get an understanding of what the campaign was about and what we were ready to embark on. So this marked the birth of the Let's Make Healthier Choices campaigns and the further development of the NCD COPA, the alliance which we formed. So you will see that Belize also supported the call to action, as Maisha was saying before, where all regional countries lobbied to get support from residents to vote on that online e-petition. Out of the birth of this grant, the coalition was formed, the NCD COPA. We recognize that in meeting and discussing all our individual goals and our interests, that we shared one underlying fact, that we wanted to see a healthier Belize. So we recognize that the creation of this alliance would have a greater impact on the Belizean community together than us doing it segmented apart. We received all the inputs from all organizations present, and we developed that 6-month action plan. We shared our limitations, our resources, and we built friendships and strengthened the capacity of not only civil society organizations, but everybody that formed the alliance. We further then developed an oath of commitment that organizations would sign to solidify that we were all working towards that one united goal. As you can see, we had to map our environment. We understood that we are in a political environment. We have private sector that we need to look out for. We have our parents or children or schools. So we decided that being that we were all for the same goal of reducing overweight children, we began lobbying our leaders, sensitizing government, religious leaders, community leaders, Mayan leaders of different origin, because childhood obesity didn't just affect English-speaking persons, it affected our entire Belizean community. We put aside our individual interests and we worked towards one national goal of increasing the awareness, advocating and agitating for policy, and raising the education and understanding of what obesity is and the effects that it has on our children. We then move on to outreach sessions, which support all sectors of the country. As I told you, this was such a big task that it could not be done by the Cancer Society alone. It had to include social partners. So some of the work that the coalition was involved in, we did community fairs, health promotion campaigns. That's a Let's Make Healthier Choices campaign. PAHO was also the birth of the water campaign that we urged persons to tag themselves on social media, get out there. We did education sessions to churches, community groups. We supported health education in rural communities in multi-language. We also did trainings for the school vendors that feed our children at the schools for them to understand the effects of what was happening. We also did free health checkups for them to understand that they're not as healthy as they think as well, and that was really an eye-opening experience for them. We offer wellness day that we did free screening, health education services. We also do mass media campaigns that we create champions. We were so happy that we were able to create champions from adolescent persons that were affected by obesity, young children trying to fight obesity, community leaders and school teachers just wanting to support the initiative and get out there and to spread the education. And we also got support from all our leaders understanding that obesity is a national issue and it's absolutely serious. So we have to say thank you to our Prime Minister, our Minister of Health, our Attorney General, and all those leaders that supported the call from the beginning. Now, the way forward for the Alliance, we hold meetings once every 2 months. We continue to work for the commitment of the Alliance and the fulfillment of our goals. We hope to become more visible and support more community health initiatives and to create more policy champions, to see more children getting involved, more adolescents getting involved, wanting to get their message out there, sharing their experiences, because these are the things that they identify with. We also want to ensure that we create a sustainability for policy and legislation. We're so proud of our sister countries getting these policies and legislation. We look up to them and we hope to imitate that soon. So collectively, we're sure that if we continue striking the fire at all corners, all organizations together fulfilling their personal mandate as well as a collective unison mandate, we will reach our ultimate goal, which is to halt the increase of childhood obesity in Belize, in alliance with our national strategic goal in the Belize National Plan of Action for the Prevention and Control of NCDs 2013-2023. This aims to reduce NCD premature mortality through integration and action on NCD risk factors and their underlying determinants. And this, we realize, could only be done from a multi-pronged approach. It cannot just be health. So currently, some of the members of our alliance ranges from the Red Cross, the Mental Health Association, the Diabetes Association, the Kidney Association, the TB Chest Clinic, the AIDS Council, public health officers from the Ministry of Health, HECOPAB, the National Health Insurance, BFLA, Belize City Council, PAHO, along with a lot of other persons wishing to lend their support. And we invite you to come on board. Thank you.
So thanks very much, Heather. So now our final presentation, quite appropriately, is being provided not by a child, but certainly by a youth. This is Pierre Cook Jr., who is the HCC's youth advocate. Pierre is going to share with us the importance of engaging young people, the Youth Childhood Obesity Prevention Agenda. Pierre.
Good morning, everyone. First of all, I'd like to say thank you for involving me in the process. I'm really happy to be a part of it. And I'm glad that we all recognize the importance of youth in this area. So I'll just jump straight into it. So firstly, why the youth? Now, I personally believe that it is important that in any conversation regarding young people or regarding children, especially where there's a talk of policy and implementing strategies to change our lifestyle, that we should be involved in the process and there should be nothing for us without us. I also believe it is important for young persons to have genuine advocates, genuine youth advocates, to reach out to them. I have two examples here. We have Daniel Allen and Chloe. Daniel is a young man. He's living in Barbados and he has obesity, and he had an advocate for this, and he's attended the Heart and Stroke Foundation Youth Gym, and he's even attended the World Health Assembly in Geneva. And he can genuinely speak to other young persons and explain to them, why it is important for them to change their diets and to live a certain lifestyle. There's Crystal. Crystal is living with type 1 diabetes, and I must say she's rocking it because she's honest and she bears it all, and she gives you a real feeling of what it can be like for a person who's living with diabetes, who's living with an NCD, to live a life that is, quote unquote, normal, and other persons can relate to her. So they're relatable advocates, and I believe as youth we can relate to our peers. They can relate to us in a way that they wouldn't with other individuals. I believe our biggest tool is peer learning and engagement, where we spend most of our times during the day with our friends, whether it's at school, whether it's on social media. The world has evolved and we can wake up and talk to our friends and go to bed talking to our friends. And as youth advocates, we can live a life where others can look at us and see, being healthy and living and practicing a healthy lifestyle can help you, it can be fun, and it is manageable. So involving youth, why should we involve youth in the process? Now, firstly, youth, we're not really encouraged to be a part of these forums because it seems a bit overcomplicated and too technical, and sometimes it can be intimidating for us. And some might think that you need to be a super scientist to be able to advocate for a healthy lifestyle, but you don't have to. I am not a scientist, I'm not a science student, but I believe that I want a good quality of life, and this is why I'm involved in this space. I believe it is important that we reach out to diverse youth groups. There are many youth groups across the Caribbean and in Barbados that are involved in projects. There's the United Youth Leaders of Barbados, there is the National Youth Parliament, even student councils. And youth being involved in building and designing the strategies for advocacy is important because you get a sense of what we are feeling, where we want you to go, what will happen if certain things are put into place. And it also helps us to understand what is happening in our society so that when policies are changed, we don't feel left out. We don't feel despondent in the advocacy area. It is also important that you build our capacity as advocates, because I believe that if you're going to speak for childhood obesity prevention, if you're going to speak for challenging or dealing with NCDs, you need to understand what is happening, what policies have been put in place, what policies are we looking to put in place exactly, what is happening in the space so that we can be informed in the process. So it's important that you build the capacity of these persons who are looking to be youth advocates. Moving on. I believe in watching the growth and in dealing with young persons in this space, I know we have bright ideas, we are passionate, it's also important that in this area that we have someone or persons who can steer us in the right direction. I know that sometimes persons may come in and they might try to micromanage the process, but allow enough room for young persons to flourish and give their ideas, but also be there to show them, there's a strategy to do this, there's a certain way to do this, or there's a certain way that you have to do this, so that we understand exactly what we must do and how we must do it, but also give us room to flourish. Motivate and empower. Young people need to know and feel like their ideas are appreciated. You need to feel as if, they are being, it's useful, and in being motivated and empowering us with the tools and the areas, the forums to present our ideas and to speak on matters affecting us, it allows us to participate in the process. There are many ways or many groups that I see who seek to empower young people, and it has allowed them to flourish and grow and become spokespersons for areas. There is the NCD Young Leaders Program. This is a global program, and it just shows that the world is evolving, they're changing to recognize the importance of youth in the advocacy space, to understand that youth speaking to youth is better than someone else or adults coming down and speaking to us. As I said before, some of the information can be really technical and complicated, And my thing is, young persons, myself, I can translate some of this information after I do my own research to share with my peers and in my day-to-day life, be an advocate for a healthy living, for a different lifestyle, for a healthier lifestyle. How do I advocate for childhood obesity prevention, and how can others advocate for childhood obesity prevention? So on the slide, you'll see a list of groups that I'm involved in. And why it is important is because in all of these groups, they have a different outreach, a different group of people that they can reach out to. I know with the United Youth Leaders of Barbados particularly, they have a Korean Youth Leadership Retreat where they involve young persons, young leaders, young advocates, and they encourage them to fight for a cause, to build a project around that project, something that will be focused in helping the community. And I know this year in particular, they are focusing on NCDs. So it gives opportunity for young persons to reach out and be advocates. Even myself, I find that since I started with the Healthy Caribbean Coalition, my life has been, kind of under a microscope where my friends are looking and saying, what can we do, Pierre? Is this, a good thing for me to eat? Is this a good option? They come sometimes and they sit with me, health expos at the college I'm asked to speak at. There's one that I'm going to run to in a bit to give some information on. And it just shows that people are looking for youth advocates who can speak to young persons in a way that they understand and they can appreciate. And I believe in this new narrative that we're looking to find to attack or to deal with the issue of obesity prevention and NCDs, it is critical that young persons are involved in the process from the inception to the execution. We don't just want to be at the table to say, tick a box and say the youth were involved, but actually be actively involved in creating strategies that affect us, because at the end of the day, the policies that are put into place will affect us in the long run. Adults and the older persons who are involved in helping us, after a while, they'll be off, but young persons, we are the ones that have to deal with these policies and live with it. So it's important that our input is appreciated and valued in the process. So once again, thank you so much for having me to be a part of this, and thank you to the other groups that gave input and also pointed out that they have used youth advocates and youth champions in their advocacy. I believe it is really important that we are continued to be involved in the process.
So thanks very much, Pierre. And so over the past hour or so, we've had a very rich and varied and detailed set of presentations from across the region. We've had presentations from academia, from PAHO WHO, and from civil society, and last but by no least from the youth experience. And so over the course of the presentations, we have had several questions that have been posed to us. And if anyone wishes to submit any questions, please type in your question. In the meantime, I'll just begin by sharing one or two questions, and then we'll get responses from the particular person to whom the question has been addressed. I just remind the presenters that you need to unmute when you respond. And so perhaps the first question that has come in goes to Professor Samuels, and the question that has been posed is, what, in your opinion, as a highly respected senior academic, what, in your opinion, might advocates be doing better than what we're doing at the moment in the Caribbean as it relates to childhood obesity prevention? Professor Samuels.
Thank you. So I think I want to pick up on the last presenter's statement, which is that I think that we have not sufficiently involved the youth and we have not sufficiently done our market research. So what we're trying to do is to change a culture, shift a culture. It's like going from being a smoking culture to being a non-smoking. It takes a while, but it's important for us to not just say to people, here is healthy food, eat it, as if it's a prescription, but we need to and develop a way to involve them in selecting which of these foods should be promoted. I think that people have different tastes, and we should address that, and we should involve the private sector. I know that, you know, in some instances, people are reluctant to involve the private sector. The private sector is a mixed bag, but it's the private sector who feed people. We do not feed the people. So if there's to be a change, it has to be through engagement with the private sector. So I think those two things, I think market research in looking at what people actually like and trying to promote that healthy, and also involvement of the private sector.
So thanks very much, Professor Samuels. A comment has been made that that in Jamaica, the children are the individuals who are taking the message to their parents. So that, I think, it's a very interesting experience from Jamaica. Another question that has come in is to Dr. Morris, and the questioner asks, what is PAHO doing actually on the ground in country and member states in support of childhood obesity prevention? Would you like to share that with us?
Okay, that's a very broad question, requires a very broad response. I started by outlining the BFHI, Baby-Friendly Hospital Initiative. So starting at birth, because we know of the links between breastfeeding and preventing obesity. So we have been working with quite a few Caribbean countries in implementing the BFHI, getting hospitals certified baby-friendly, which means that children get that good start in life, breastfeeding exclusively from birth, which has been linked, as I said, to prevention of obesity. We're also working with schools in developing their school nutrition policy, looking at their school feeding, for example, how food or school feeding standards, and as a matter of fact, the standards for all the food in schools, whether as part of a school feeding program or anything that is sold in the schools, is in keeping with good nutrition. So establishing norms so that children are not having too much sugar, not too much fat, and other too much unhealthy food. So that's as part of school nutrition standards and school nutrition policies. And another thing that we have been looking at also is how the whole issue of front of package labeling ties in to what people understand about nutrition. So people are buying foods, packaged foods. Do they understand what the label is saying? And this applies to schools as well, because children need to be given, or they need access to healthier foods, but those persons who are responsible for providing the schools the foods, whether to children or adults who are shopping, need to be able to understand what is on the label. So in line with the PAHO nutrient profile, which really outlines limits for fat, trans fat, saturated sodium, and what's the other one? We really look at the limits for these nutrients in foods, and we are working with CrossQ, the Caribbean Regional Organization for Standards and Quality, in developing a front of package warning that people can understand, that tells them that this item is high in fat or high in sodium, and so that they may make a decision about whether they want to purchase it. So I think those are just a few of the on the ground activities that we're undertaking.
So thanks very much. And really a part of your response addressed an issue that was also raised, and that was an issue as to whether or not there was a mandate to address the sale of sweets and confectionaries at cashier counters in supermarkets, corner stores, and school canteens. And certainly to the best of my knowledge, and I speak subject to correction, I am not aware of such restrictions in the Caribbean, although there may well be, particularly in the schools in Trinidad and Tobago. And so that brings me to another question that has been sent in, and that is to Pierre, in which the person who submitted the question pointed out that it seems you're attending the Barbados Community College, and the questionnaire wanted to know what was the status, the health status, if you will, as it relates to sugar-sweetened beverages and other items that predispose to obesity at the community college. Pierre?
Okay. So at the college right now, there is a high culture of young people who just drink sweet drinks for everything. For breakfast, they use a Coke. For lunch, they use a Coke. And what I found is that they don't understand the amount of sugar, rather the amount of sugar that's in it, the amount of sugar that they should intake. What happened is when I did a expo presentation at the recently held expo, and I explained the amount of sugars that are in these drinks, and the amount of sugar that they actually need in their systems from day to day, they were shocked because they didn't know that, these drinks contain 2 servings, that, there's so much sugar that it can affect me this way, there's a bunch of empty calories. So I believe that the culture here, it's not healthy, and it's not health driven at all, because around the environment, what we are exposed to are not many healthy options, which is why it's also important that in making choices and in providing choices for young people, or providing choices for children, it is important that the options are all healthy, which is why I believe, programs should be put into colleges and schools where the food or whatever is offered on these premises are healthy, so that if you have to make the choice, you only have a healthy choice.
Thanks very much, Pierre. So this question was put to Barbara. It seems as if the questioner is aware of the Jamaica Moves initiative, and they've asked, how does the initiative, that is the Jamaica Moves and the Ministry of Health, how has that contributed to the success of the Heart Foundation of Jamaica's national campaign? So perhaps you might tell us a little bit about Jamaica Moves and its contribution to the childhood obesity effort. Barbara?
Yes, actually the Jamaica Moves program was launched prior to the Heart Foundation Chapter program, although the Heart Foundation has it. At first, we have somewhat what Professor Samuel said earlier, that their focus was on physical education and keeping fit. However, phase 2 of the campaign for Moves at healthy eating, and a balanced lifestyle and so on. So when we got the project from Bloomberg, we went on a courtesy visit of health and to share co-brand. So the co-branding was good for us, but it was also for Jamaica Moves, because for media campaign had their logo, both the print, electronic, and so on. They are now working on a strategic plan for Jamaica Moves for the next 5 years, and the Ministry of Health is working on Jamaica Moves ambassadors in certain schools. There's a small group of schools, training them. Of course, this is in tandem with the sugar drink restriction, which came in January, and then the school nutrition policy is being revised as well. So the whole collaboration has been very positive. One thing we did see, Dr. Winter did some in the schools and found that several of the schools had already started sugar drink restriction prior to the January date from the ministry on the campaign, the joint campaign.
Thanks very much, Barbara. Another question that has come in is addressed to Heather, asking her if she'd be happy to share any experience that the Alliance has been having as it relates to vendors in and around schools.
Thank you for the question. Well, we had a very unique experience with our vendors. We invited all our vendors to an education session. We literally had to convince them why it was important for them to participate in this session, but we had the support of the Belize City Council, the Public Health Department, which is the enforcing body for these vendors. So they found it a bit important for them to be here. So we started off not only giving them health education tips, because they were a bit apprehensive in coming in for somebody to tell them how to modify their foods and their drinks, which they have been making a profit on for all these years. So we started with a different approach. Our approach for them was that we wanted our children healthy, but we needed our vendors even healthier to ensure that what they're preparing for our children will be beneficial to their body, and that they are pushing type of products that parents can be confident that when they give their child funds to go to these schools and they're at the education department, that their kids are safe, they're eating the proper amount of water. So our approach is that we gave them a health day. We got in our doctors, we gave them blood pressure checks, blood sugar checks, their height and their weight, their BMIs, and we taught these vendors how to calculate their own BMI. We showed them what their blood sugar levels were, what their blood pressure levels were. And we started with the nutritionists that started to show them the same foods that they're preparing, what content of starch and what content of sugar. So that's why I was talking to our colleagues, and I'm saying a lot of people don't realize and don't know how to calculate the amount of sugars that we put in our juices and our foods. As a Caribbean culture, we mix our juices, we dump in some sugar, we don't even use measurements. So having these vendors understanding when they say, okay, I put 2 to this juice. When you pull these packages and they do that activity, it is alarming for them. Then you bring in the chefs, showing them how to take the same food that they buy, because one of the issue is they tell you their expenses low so that they can make a profit. The cost of killing our children and killing yourself. So turning them into advocates, showing them how important it is, and also bringing them in, but showing them that they can gain something from this as well, not only knowledge, but we try to provide them with aprons, we try to provide them with hairnets, we provide them with garbage cans, and also teaching them the hygiene aspect of it. Because obesity, as we said, is not only a health issue. Yes, it's eating unhealthy food and drinking sugary drinks and lack of exercise, but it also has to do with your hygiene, it has to do with your education, your mental capacity to understand what is happening. So that was a unique experience for us, and the vendors that were there, out of 22 vendors in the city, we had 17 that attended, and they were very grateful. They even asked the city council at our last meeting when we would hold another session for them. So as an alliance, we're looking to this and to support another training for them, as well as discussions with 2 schools in particular in our immediate area that has asked us to step in and kindly assist them with getting these vendors from their streets or modifying their snacks. So we're absolutely excited about that opportunity. So I hope that explanation helped.
Thanks very much, Heather. It's interesting. One of the comments that we've had from one of the participants on the webinar is a comment that relates to the issue of the mental health of children and the overall environment, if you will, and the importance of this as it relates to childhood obesity. And certainly this is an issue that is an aspect of the childhood obesity narrative that we need to be conscious of, and therefore I think that comment from one or two of the persons on the webinar is a very important one. Well, I'm looking at my watch, and I think we've now got about 2 more minutes before the end of the scheduled close of the webinar. Before I hand over to Maisha to provide concluding and summary comments, I simply wish to thank everyone for participating in the webinar. The presenters have been outstanding. You, the persons who have taken part in the webinar, much appreciated. There's been a lot of written submissions that are worthy of further consideration, and we're delighted at the significant number of persons who've registered to take part in the webinar. I just simply wish to apologize, if that's the correct word, for the slight technical problem at the beginning of the webinar, but in many respects it was beyond our control. I now ask Maisha to bring the webinar to a close. Maisha.
Thank you, Sir Trevor. And I'd like to echo thanks to everyone out there who participated, and thank you to our team led by Jenna, who really worked with Ian Pitts as well to organize this the first of our series of webinars. There are a few other comments that we had on subsidies for healthier options, which I wanted to acknowledge, and earmarking a taxation revenue. This is the first of a series of webinars, and one of the webinars we will be covering SSB taxation. Our next webinar, tentatively scheduled at the moment for May 30th, will focus on front of package warning labels. So we look forward hopefully to your participation in these upcoming webinars. Thanks again for tuning in, and please tune in for our upcoming webinar series. Enjoy the rest of the week.